About 50% of diabetics have neuropathy, okay? The range in the literature is from 18% to 65%. It's more common in those that are chronic and not treated well, but believe it or not, neuropathy is actually more common in the pre-diabetics. Why? Because they're living in this hyperglycemic state that's just not high enough to hit that number where the hospital system says you have diabetes. But really, you have a big problem because you're running around with your sugar too high. And those people get a lot of neuropathy even before they're diagnosed with diabetes. Well, here's the problem. Only if you're diabetic does insurance cover anything for your feet to treat this kind of pain. So it's almost like you have to get that diagnosis to get treated. But you really want to treat it when you're pre-diabetic, right? So it's kind of one of the many conundrums we deal with in medicine when dealing with insurance companies. Then you've got reduced signal transmission to the spinal cord. Okay, a lot of diabetics have a depressed reflex at their Achilles, and then sometimes even the knee, but very common to not have an Achilles reflex. I see this all the time, get misinterpreted or misdiagnosed as a sciatica or a lumbar radicular lesion that's causing a depressed Achilles reflex, and then these people get indicated for surgery when really it's just their diabetes. It's very sad and unfortunate. Alterations in gene expression patterns and channel properties. Remember the channels, whether they open or close? Well, that activity and then what molecule they're going to let through is regulated by the genes, which are regulated by DNA methylation, which comes from epigenetic modifications from diet, chronic inflammation, oxidative stress, et cetera, et cetera. And so you can see how hyperglycemia can do all of this. It increases inflammation, so you have more of these inflammatory prostaglandins and whatnot, changing the membrane threshold. You've got oxidative stress that's causing different products to be released that are irritants and also changes the cell membrane, also damages the DNA, damages a protein of the receptors. You've got glycation, which is advanced glycation end products. So the sugar gloms on to the protein of the receptor, free amino acids, totally changes how everything works and can make all the tissue thick and dysfunctional. That alone can cause a lot of nerve compressions and neuropathic changes in diabetics. I see it all the time. Very thick, scarred connective tissue, and that sometimes requires a surgical release. And then the polyol pathway is just a different way all this free glucose floating around is managed, which damages nerves. So diabetic peripheral neuropathy is a huge problem, getting bigger and bigger. More and more people are diabetic worldwide, especially in America, and we're just going to keep seeing more and more pain, unfortunately.